So as the world marks the World Autism Day, I would want to do a small talk on autism disorder. And you find that this is a disorder that is characterized by a neurodevelopmental disorder, which is characterized by social difficulties. There is also communication difficulties, which will include verbal communication, delay in talks, or having difficulties with the communication, and also there is difficulties with behavior. So children who have autistic disorder, they are divided into 3 levels, which we have level 1, whereby they have small challenges in the 3 areas that I've mentioned about: communication, behavior, and social interactions. There are those in level 2, they require support, and they have some verbal challenges. And then there is level 3, who really require some substantial support. In our country, the data that we have of kids who have autistic disorder, they form about 2.5% of the general population, and mainly the challenge is the interaction with the kids have, and their communication can be very challenging. And the parents who have this kind of the kids with this disorder can have a lot of challenges in trying to bring up these kids up, because of the behavioral disorders, the communication disorder, and also the communication disorder. And so this is a genetic disorder. It is not by any of the parents' fault, and so we should really support them. And what we should realize is that this is a medical condition, is a neurodevelopmental condition which can be managed. And the main modes of management is basically, the first thing is to identify the kids who have this problem. And usually they can be identified from the age of 12 months onwards. And depending on the support that the kids are given, then the difficulties can progress, or some of them can regress. So the society should help identify these kids, so that we are able to help them and also to support them in the appropriate way. So the main issues in the management of these kids is the behavioral support, where they need to be supported to develop their behaviors. Then there is also the environmental stimulation, because they might not respond as appropriately to communication. They might not have proper ways of socialization. So we need to help these kids in being able to integrate them into the society. Some of them might have very minor defects, and they can be able to integrate very well in the normal school system with just a bit of support, and that helps them fit into the society as normal individuals. We have the Autistic Society of Kenya, which helps in helping the parents and also the kids in various ways. There are also various centers in the countries that are developing places of excellence to help these kids, so that they can develop as is required. Machakos Level 5 is one of the places where we are developing a center to help these kids who have autistic problem. To the general health providers, it's my encouragement is let's try to identify the kids that we feel could be having autistic problem, and then refer them to the specialist, the psychiatrist and the child psychiatrist, who have the capacity to make the definitive diagnosis and also help manage them. autism on its own is not managed, but there are other ways that, as I've said, behavioral support, speech therapy to help with communication that can be assisted. There can also be some pharmacotherapy, especially for some of the abnormal behaviors that they might manifest, which can impair the management of other aspects of their illness. So autism is a common disorder. It is affecting our kids. As a society, there's a lot of stigma associated with it, and you find that parents who have these kids who have autism, they tend to be stigmatized a lot, and many times they might manifest abnormal behaviors in public areas, and rather than stigmatizing them or enclosing them in places, we need to reach out as a society. The question that we should always ask ourselves is, how can I be of help to the parents, to the kids who have this problem, so that we make them, some of them can be highly talented with very special talents like in music and other aspects of life. So these are people who we need to help to develop, not to stigmatize them, and to support them, especially in families, because taking care of a child with autism can be quite a challenge, and we need always to reach out. Before we make negative observations, let's always ask ourselves, how can I help? That would be my message for today. Thank you.